All right. Welcome back to the Appleton Area Health Podcast. It's season 2, episode 1. We took a break over the summer and the start of the fall here, but we are back now. And we're planning on doing a 6-episode series here on whole person wellness program that AAH will be launching sometime soon. So with us today, we have Lesa Tilke, Kelsey Tollefson, two providers from our clinic here. Lesa and Kelsey, how are you today?
Good.
Good. All right. And Lesa, for those that don't know, who are you and what do you do in the clinic?
Family nurse practitioner. So see anybody from birth to 99, I guess, or 100, however long they are. Yeah.
Awesome. Kelsey, what about you?
Yep. So I work in the clinic as a mental health therapist, and I usually see people over the age of 15.
Okay. Excellent. So this whole person wellness program, where did this idea come from and what it's all about?
Yeah. So this program kind of was just an idea that we had come across after reading some books, gathering some information, and really learning about how health can be different and better. And there's maybe a way that we can help our community to be a little bit healthier. So we actually kind of just started with the idea of, well, can we maybe help our employees get healthier with yoga or, nutrition classes, things like that. And it's grown with a team of people to create the whole wellness person program.
What about you, Lesa? What interests you about this program?
Help people live a better life and more healthy life. Like if you live to be 99 and you're not healthy and you have chronic health conditions, like you don't have a very good quality of life. So the quality of life is probably more important than the quantity.
Sure. Okay. And so one of the books that we're going to be drawing from quite a bit in this discussion is Outlive, The Science and Art of Longevity by Dr. Peter Attia. And he makes a lot of great suggestions in his book, but we want to look at it from a local lens, like in Appleton Area Health. How can we apply some of the things that he talks about in his book for our clinic, our hospital, our patients, and our residents? And how are we doing it already too? So it's going to be a fun 6-episode series here. And today we're just going to kind of do a bit of an overview of what you can expect over the next 6 weeks and what you can expect out of this program. So what is proactive health? What's this idea all about of being proactive with it?
Do like the screenings ahead of time, like for cancer, heart disease, lab work, different tests and then like focus in on what problems you think you have in your life, like if you're not healthy or your diet or you're emotionally stressed, to focus in on those, dial in on those, because they all kind of like feed together and cause, like if you're stressed out, you can have heart disease because of that, or vice versa.
And I think essentially proactive health is a step ahead of preventative health, preventative care. So we're really looking to dive in to understand some of those markers even before they potentially would happen. And I think that's part of what this program is doing, is taking the data and understanding where people's health is at and how to make it even better.
Yeah. Okay. So Lesa, you touched on this just a little bit about this idea of like health span versus longevity. Can you talk a little bit more about that? What is health span in your mind?
Health span would be like living your healthiest life possible without like the chronic conditions, cancer, heart disease, diabetes, those things, because they are preventable for most patients. So I feel like if you're proactive with trying to like make your life as healthy as possible, doing moderate exercise, diet, whatever the case may be, then you are living a longer, healthy life.
Okay. Awesome. One of the charts from the book that I found really interesting was when he was talking about medicine 1.0 versus medicine 2.0 versus this medicine 3.0. This is proactive health that we're talking about. And the 1.0, shows a kind of a pretty steady decline towards middle age. Medicine 2.0 delays that decline maybe a little bit more, but then goes down. And then Medicine 3.0 is a long health span, and then a sharp decline right at the end. I think that was just a really interesting graphic that he wrote about in the book. So that illustrates this health span that we're looking for. So what are some of the components that we're going to be focusing on this season for the podcast here, and with the Whole Person Wellness Program as well?
Yeah, so with the Whole Person Wellness Program, and I should maybe clarify exactly what that is right now.
Yeah.
So the Whole Person Wellness Program is launching actually right now for some of our employees. We have today. We have a small test group that we are starting with to kind of to work out some of our bugs in our system of how we're doing things. So we are starting with our test group. And each of our participants is meeting with Lesa to go through an assessment and talk through some of their health concerns, what some of their priorities are, and how they want to improve their health. So we focus, of course, on physical health, but also things like nutrition and sleep and mental health. And exercise, all different kinds of things, including community, spirituality, different things like that. And we do that through this assessment, and then also through different biomarkers. So we track some of the data over time to see how the numbers improve or even decline, which will help us to understand where the participants' health is at. So we're launching this for employees right now. Hopefully we can open it up to more of our employees, maybe later this year, even the beginning of next year. And it's our goal to eventually open this up to the public as well.
Excellent. So that's a great point, that eventually it's going to open up to the public here. And I think we talked about yesterday and just this morning too, about some of the numbers for our community here in Swift County and in the area. A couple things that folks may not know, but premature death, this one blew my mind, you guys. The premature death between 2018 and 2020, Swift County lost an estimated 8,100 years of potential life before the age of 75. And that's just a short period there. Causes of death: cancer, diseases of the heart, and then accidental deaths. So that really kind of an eye-opener. In the clinic, Lesa, obviously speaking in generalities here, but what are things that you see that are kind of common amongst our patients?
Diabetes, heart disease of many different kinds. Those are mostly the hypertension, coronary artery disease, high cholesterol, and a lot of diabetes, it seems like.
Sure. Yeah, the data, shows we're higher than the state average in diabetes. We're higher in adult smoking and adult obesity. So alcohol impaired driving deaths, much higher. So,
and that's probably where your accidental comes in.
Right. Yep. Part of it, too, is the food insecurity. We see some socioeconomic things too when you look at that data. So very interesting. So, advice for folks as they listen to these episodes and kind of explore, the different topics. What advice can you give folks, Kelsey, as they take in this information?
I think my advice would be, I would encourage you to be open to learning, to understanding your health. Not that you have to make drastic changes or large changes, but I think it's important to understand what our bodies are doing and perhaps the things that we can do eventually to improve our health span. And we hope that with this program, we can maybe have more of an impact on our community as well. So I guess in short, my hope is that you can learn from the information and knowledge that we provide.
Lesa, anything that you'd like to add there?
No, that was really good.
Well, thank you for tuning into this first episode. Again, we'll have episodes launching weekly covering these different topic areas. This was just the introduction. But again, like, subscribe, and share. Thank you.